My cocaine habit is not what I'm here for. It is not the problem. What I need you to help me with is with my anxiety and depression. I have a mental health problem. So I want to be clear. I'm not here. I don't want to discuss my habit with cocaine. I like to use cocaine with my friends sometimes in different situations because of course that matters. It's a situation and how you use cocaine. It makes it okay. So I just want to be clear. I'm here to get help with motivation. I like to improve my quality of sleep. I need to get better at time management. And as I said, I have a mental health problem, and I want help with being able to manage anxiety better and to be able to do something about when I have this depression that can happen as well. So I just want to be clear. That's what I'm really here for. This issue of me using cocaine, that's not what I came here for. And I hear this a lot from people, or have over the years. This idea of kind of like this idea of what is a person's perception of a problem, right? Or perception of their situation. Because a lot of people do have this issue. Not only is it a perception of their problem, but readiness to make changes. And some people may speak to issues of having insight into their behavior, how things are connected, and so on. Because the perception of the problem, readiness to change, it's everything. It really is when you're working with individuals. As a therapist, when I work with individuals, one of the first things I assess for, well, one, why are they showing up to therapy? Two, what is their opinion of the situation? What is their perception of, is it not a problem? Is it slightly serious? Or is it very serious? What is part of their context that they identify as part of the problem, and their willingness to be willing to change things? Because drug abuse and substance abuse, it doesn't matter so much the chicken or egg argument, what came first, substance abuse and then developed mental health symptoms, or primarily maybe have a mental health issue associated with different reasons that contribute to a mental health problem. And then later on, as a result of mental health, they got into substance use, drug use as a coping mechanism, and so on. And now they have both situations going on. Mental health symptoms co-occurring with a substance use problem, addiction. So there's conversations to be had about that for sure. And there can be a time for a conversation about these issues within a context where it has some relevance, and maybe how you approach treatment of certain people and how to address their improvement of their overall health. But make no mistake, either way, whether it's the chicken or egg coming first, substance abuse, whether it's cocaine, cannabis, alcohol use, opioids, I mean, pick a drug, definitely needs to be addressed. Because what happens is when, like the example I was using earlier, is that, hey, I want to be clear, I'm here because I want you to help me with my anxiety and depression. This stuff I'm talking about when I use cocaine, that's not why I'm here. That's not my problem. I'm depressed, sir. I'm depressed. I struggle with anxiety and motivation, and that's what I'm here for you to help me with. So why you keep talking about all this business that I like to use cocaine during the week, right? That's not why I'm here. So this dismissiveness of the drugs, of their use of drugs, is definitely, well, there can be, denial. You can talk about denial, rationalizing, justifying a behavior, or just plain old lack of insight. They do not see that connection systemically, how this does contribute to their overall presentation of their symptoms and health problems. Because a person who, if it's a chronic habit of cannabis use daily, abusing alcohol, stimulants like amphetamines, cocaine, opioids, whatever the drug situation may be, definitely undermines the prognosis and chances that certain things can get better. For example, being able to regulate emotions better, have emotional intelligence, being able to process emotions and feelings, to vet our emotions and feelings, right? Are they based on a more healthier way of thinking, considering other behaviors? So if I am stoned, right, I get stoned or I get faded, that's a problem. Definitely undermines, your capacity to process feelings and emotions and understand them. Not only understand them and have your experience of them, but to articulate them and express them with other people can definitely be diminished, undermined, right? So blunted affect, maybe a flat affect. I'm so stoned and faded. It's not an accident. They're called these things, being stoned, feeling faded. I knew an individual who worked as a waiter in a restaurant would say, "Hey, I'm gonna get faded before going into work." Yeah, they'd get high, smoke a joint, because they knew when they went into work it could be challenging working in a restaurant. I used to work in restaurants, right? I was a bartender back in the day. I was a bartender for nightclubs too. So yeah, it can be stressful. So if you get stoned, you're faded, you get a bit of that blunted affect. It dulls the senses, if you will, with regards to your emotional experience to situations. So people do that. It's an unhealthy coping mechanism because emotions have utility, purpose. And so if we're diminishing that, it can result in problems in other areas of our life. So there's that. What about sleep? If I want to promote a healthy sleep schedule, drugs definitely can destroy and undermine quality sleep, particular to REM cycle sleep, the deeper stages of sleep. So cannabis creates issues there. So does alcohol. You get the idea. What about interpersonal skills, issues of intimacy and trust within relationships? Motivation, right? Motivation, I like to describe it as more of a priority management issue. We prioritize things based on where we assign worth and value. Not everything's a motivation problem. Motivation does not always wake me up in the morning to go to the gym to work out at 5 o'clock in the morning. What gets me out of the gym, what gets me to the gym in the morning, waking up at 4 o'clock to get there at 5, are my values. I place value on exercise, my health. That's really what wakes me up in the morning more than motivation. So these are more priority management issues. So substance abuse, drug abuse, 100% will undermine prognosis for better mental health. But this is something that's not anything new. I mean, this happens a lot. And I've been in the mental health field since 1996. So I, been a, licensed therapist in the state of Texas and practice in the mental health field. All of my experience for the better part of at least 25 years or so, something like that, maybe 26, a bit. So what I have seen is this issue of there's a lot of things, but a couple of things that I start looking at. And on an outpatient basis, if I'm going to be someone's therapist, I assess, one, what is the person's perception of the problem? What is their idea of their problem? What is their belief of what's involved with their problems? Their perception of how serious it is, right? Like with using cocaine, an example I used at the beginning of the video. It's not really a problem, no big deal. Maybe it's kind of a problem, or maybe it's a serious problem, right? Sometimes people put the cart before the horse, sometimes in terms of how we approach things. All things, nonetheless, will have a need to be approached if you look at our life systemically. Physical health, mental health, maybe your job, relationships, other things that affect our life systemically. It all adds up to the whole person. And the order in which we approach things might vary too, right? Order of importance, kind of like a triage approach. What has the most sense of urgency? So if the example of talking about people who have substance abuse issues, alcohol, which is a drug, and other drug substance related behavior that have this dismissiveness, or they're in this denial that it's really not part of the problem. There's really no reason to make any changes in those areas. I liken this with an extreme example. I like to use extreme examples sometimes to make a point. So imagine a person who's in an emergency room. It's a trauma center. They have been assaulted. They've been both shot with a gun. I got a bullet in them. There's a bullet. Maybe it's a half an inch from their heart. And they got stabbed too, a knife wound. And there's a knife still stuck in them, which is about maybe an inch from their kidney. Maybe it's close to a major artery or something like that too. So this individual who's still conscious is being, taken into the emergency room. They got him on the gurney, and get him to a medical room, and they, before they're put under anesthesia, they hear the trauma surgeon saying what their approach is, their plan is, their strategy to go in to get that bullet out. That's close to their heart. They're discussing that procedure. And the person, before the mask can be put on them for the anesthesia to put them under, the person starts to argue with the trauma surgeon saying, sir, the bullet's really not the issue. It's that knife. It's in my back. You need to pull that out. That's really more of the problem right now, right? I need to get that sucker out of me. That's the problem. I'm not really, that bullet, maybe the bullet waits, right? So obviously both of these situations need to be addressed. From the surgeon's point of view, they may feel more sense of urgency to get that bullet out first. And obviously, yeah, that knife needs to come out too. They both need to be addressed and they both need to be treated. What about an even more extreme, silly analogy that's just really ridiculous? How about this one? How about that person let's say they never got the knife out. This is just the bullet, right? The knife's still in them 3 months later, and they are systemically suffering from infections and other issues going on. They go back to the doctor and say, hey, y'all never got that, got me taken care of completely. I'm still having these infections, and I get this pain in my torso whenever I try to twist side to side. And the doctor says, oh yeah, you know what? We need to get that freaking knife out of you. The knife's still stuck in your back. And then the patient starts to argue, well, it's not really I'm not here because of this knife. I'm here for you to treat my infections and the pain, right? Seems pretty radical. I mean, a bit silly, right? To that kind of a logic. Because logically, yeah, you need to get the knife out. Yes, treat the infections, but we need to heal all of it, right? The knife is the underlying cause, one of the underlying causes to your infections and the pain that radiates in your torso whenever you twist side to side. So yep, that knife needs to come out, definitely as a part of the problem. It would seem to be a bit irrational, almost insane for somebody to have that kind of a logic presenting back to an emergency room saying, hey, I'm not here for the knife stuck in my back that's been there 3 months. I'm just here for you to treat the infections. The infections are just a systemic, part of the systemic issue that resulted, they're secondary rather. The infections are secondary to that knife still being lodged in you, right? And then there's a systemic way to look at the issue, but the knife's definitely is the primary underlying cause that's causing the infection. This is part of the situation for sure. So a lot of people have a backwards way of looking at things, put the cart before the horse, etc. You get the idea. So these obviously ridiculous examples is on purpose, because people in a similar sense are doing this with how they view the significance of their substance abuse, drug abuse, in regards to the impact on their mental health. Mental health includes many different dimensions that fall under the umbrella of mental health. Relationships, to an extent, or how we manage relationships to an extent, are a window into and a reflection of mental health, such as our boundaries. Do we have rigid, porous, or maybe codependency type boundaries with people? Our mood, our regulation of mood. Is our mood volatile, unstable? Do we have a low threshold for anxiety? We're easily overwhelmed or very reactive, panic attacks. What about depression, irritability? We're easily overwhelmed and easily shut down. Emotional regulation, as far as overreacting to situations, or affect may be inappropriate. Labile, very unstable. Labile meaning you can be laughing and appear happy 1 minute, 5 minutes later, you're agitated and then crying. You get the idea. So all these other measures in terms of, is there a reasonable amount of stability there? Because that's really important in terms of the overall picture, So if these other areas of our life are not stable, and we are using drugs still, and we think drugs is really not part of the problem, then that needs to be revisited, because as I mentioned earlier, things like sleep affects all of our mental health too. Sleep can be undermined by using drugs. So all this has I guess you want to call it the domino effect, the trickle effect, the ripple effect, call it what you want. Continued substance abuse, drug use does undermine goals, such as I want to have more motivation. I struggle with time management. I struggle with demonstrating patience. I struggle with regulating emotions. But here I am feeling frustrated because I expect a therapist or a treatment program to fix me, to give me the tools and the answers to fix my life so I can have a better life. The truth is, even if you intellectually can understand tools that are being taught to you, your ability to execute and use those tools to give you a different outcome will still be limited. People can be taught tools all day long, but continued substance abuse, drug use rather, is going to undermine your ability to even use those tools. You get the idea. So these are some of my thoughts I wanted to share today about this issue, people's perceptions of problems. Yeah, I'm not here to discuss my cocaine abuse and alcohol use, chronic daily cannabis use. That's not my problem, sir. I'm here because I expect you to help me with my anxiety problem. Never mind, my anxiety problem could be primarily being caused by my withdrawal symptoms. When I go a certain amount of hours without smoking cannabis, I go into withdrawal. I start feeling irritable and anxious. It's exactly what withdrawal symptoms you can get from cannabis if when you stop smoking it after so many hours since your last usage. Yeah, you go into withdrawal. You start to feel anxious, irritable. Yeah, so that's more of a withdrawal issue for a lot of people. A lot of people don't start smoking cannabis because they have an anxiety issue or even issue. And some people say they use it for sleep, which is ironic because it causes problems with sleep. A lot of people start using cannabis for other fulfillment of needs, boredom, excitement, entertainment, being social. Later evolves and develops into a dependency issue that has withdrawal symptoms. And when they're in withdrawal, they do not like the way they feel. So obviously they're going to want to smoke again to take them out of withdrawal, and then they feel calmer. And then they start describing that or, saying it's an anxiety problem. It's not primarily an anxiety problem. That's more of a withdrawal issue, addiction. People who do get off cannabis, by the way, those symptoms go away. And they actually find that they manage anxiety a lot better once they are abstinent and sober or no longer abusing or using cannabis, if you will. So I could just go into a whole bunch of directions all day long on this topic, but this is something I felt it's important to share. Maybe you're someone who's listening to this video right now. Perhaps you might use drugs yourself. You might smoke cannabis every day. Maybe you like to, do some lines of cocaine here and there. I would just challenge you, if that is you, as far as how honest are we really being, if we're going by facts, evidence, in terms of how these drugs 100% affect physiologically your brain, your body, undermines different measures such as sleep and so on. You might want to be a bit more honest about that, right? In terms of how you're looking at giving a honest assessment of your individual problem. If you're someone who is maybe tries to help people, you may consider that it's okay for you to have boundaries with these situations. Help in relationships are voluntary, just to be clear. With people who are not ready to make changes, are definitely overcommitted and rigid to defending and maintaining a narrative for why they will not make changes. But at the same time, want to hold you captive with the expectation you need to help them to change. Be careful of that. That's not. Why would you want to participate in that? It seems a bit insanity. Why set yourself up in a no-win situation? Because that's what can happen. They want to handicap you. It's like put one arm behind your back, and then expect you to help them. It's like limiting someone's tool set and options. I expect you to help me, but I'm going to limit your rational, logical tools that could help you. You're not allowed to use those, but still help me. And that's what happens. A lot of people ostensibly show up to therapy saying they want help to change something, but at the same time will invest a lot of energy into defending the reasons why they will not change, or even why it's not even a problem. It's can be pretty interesting how that happens, but it does. So there's different levels here in terms of whether or not people want to be involved with that. There's motivational interviewing is a tool or concept that's used to work with people who have a lot of ambivalence and who are resistant to changing. But even then, there needs to be a reasonable amount of at least they're contemplating considering the possibility. They're being open-minded to look at both ways. And that's somebody you have a chance to work with, right? Someone who's just too rigid, they see zero problems in the behavior. They're just too committed on always pivoting to a reason to justify the behavior, right? Such as, I only like cigarettes, tobacco. I only smoke cigarettes at the bingo parlor, as if it matters where you smoke tobacco, right? It doesn't matter. Tobacco is always harmful. Never mind, this person plays bingo 6 days a week and stays there 4 hours at a time every day. That's where they smoke. Just like cocaine. Well, I only do a little blow and coke, a few times a week, only around other people. It's just social, as if that makes it okay. What about alcohol? I only drink after 5 p.m. Well, there's something to be said about when you drink, as far as looking at different ways of looking at alcohol. But technically, it doesn't matter so much that within a 24-hour window or even during the week. Maybe you only drink 3 times a week, but it's what happens when you drink. There's a lot of ways to look at it. The point is, for different, especially more so than certain people, alcohol is just never a good situation. So what are your thoughts and opinions? Maybe you can drop some comments below in this video. A person's perception, does it even matter? Does a person need to believe they have a problem? Well, I would say they do. Otherwise, what's the point of being here? I'm here to get help with my problem. Never mind, I don't think it's a problem. What the hell is that, right? It's a kind of a insanity loop. As I've gotten further along in my career, I definitely tend to have boundaries with who I choose to work with, which is the right of a therapist. A therapist doesn't have to work with anyone who requests to work with them. It's a voluntary situation. So that's what I have some reasonable, healthy boundaries with who I choose to work with. There needs to be a reasonable willingness, open-mindedness in how a person may consider looking at their problems and what can be a part of the problem. And then 2, open-mindedness and some reasonable readiness to consider, and then yes, make some changes if they want a different outcome and result. So maybe you're someone who just has friends or family members or just people in general. Maybe you're that guy or girl, person that people like to come to a lot because you listen to their problems. You're just by nature are a very supportive person. So maybe this will help you consider what is your threshold of boundaries, and maybe how far along are you going to get involved with people to the point that maybe you just frustrate yourself and feel exhausted. You get overly invested in thinking you're going to fix someone or get somebody to change. More so in a situation where the person doesn't think that their situation is a problem with a particular behavior. And number 2, they're not even wanting to change it. So why would you even invest your energy in that? It would seem to be almost like you want to torture yourself. So there's context, of course, with different relationships, right? Sometimes people in the helping profession might work with someone who's court-ordered, or perhaps their wife gives them an ultimatum. You need to change this or I'm going to divorce you. Well, even then, good luck with that one. If that's the only reason somebody shows up to therapy, is my wife said I need to do this or she's going to leave me, yeah, that's really not a very good prognosis. If their only reason for being there so the wife will not leave them, that's not sustainable. Because if the wife leaves them anyways, bye-bye to their reasons to change. It's gone. So people have to change because they internalize some value to it, that it's for themselves. So I think you get the idea. Drop some comments below. Click like the video if you find this helpful. Maybe if you're a therapist yourself, you may probably already know these things, right? Or have heard this before. Or maybe you're not a therapist. Maybe you're just someone who's, and maybe you have a big heart, right? You're always trying to help everybody. So maybe this is something will help you reconsider some of your boundaries and expectations with working with people. So on my channel, I like to make topics or videos about different topics. Sometimes it might be mental health stuff, relationship stuff, or just my opinions on things. Right now, I'm doing a video series about my physical fitness in my 50s. As a man in his 50s, I'm 52 years old, with things like body composition goals, and I'm going to be including some performance performance measure stuff in this series, and future videos coming up. I'm working on different things. It's a process. So I got that playlist that's currently going on. If you haven't looked at that yet, feel free to drop a comment, a suggestion, maybe another topic you would like to hear discussed. Feel free to subscribe to my channel if you appreciate this kind of content. That's the best way you can support me, is just subscribe to my channel. I really appreciate it. Helps me stay motivated. Helps me to stay motivated to continue to put out more content. So I hope everybody is having a good weekend and a good day. Thank you.